When we fight cancer, we use some incredibly powerful weapons, but what happens when those weapons create their own emergencies? Today we're going to dive into two real-world cases that show you exactly how the cure itself can become a crisis. It's like looking at two sides of the same, very deadly coin.
And that's really the heart of the issue, isn't it? These modern therapies are amazing, but they work by messing with the body's most basic systems. And you know, when you push a system that hard in one direction, sometimes it snaps back in a really dangerous way. So let's look at those two sides of the coin.
All right, first up, we've got a case where the body's own defense force, the immune system, gets turned into a weapon against itself.
Okay, so here's our patient. She's 58, fighting melanoma with a pretty powerful immunotherapy drug, Nivolumab. But now she's in the emergency department, and she is sick. We're talking severe diarrhea and bad abdominal pain. So the big question is this just some stomach bug, or is this something way more serious connected to her cancer treatment?
Okay, let's play detective with her lab results, because the clues are all right here. Her heart rate's up, that's a sign of distress. Her white cell count and C-reactive protein way elevated. Those are screaming inflammation. And check out her creatinine. It's high, which tells us her kidneys are taking a hit, probably from all the dehydration. But here's the kicker, her stool cultures are negative. So this isn't an infection. The problem is coming from inside her own body.
And that leads us straight to the diagnosis, ICI Colitis. See, that immunotherapy drug, Nivolumab, was designed to take the brakes off her immune system so it could go after the cancer. But it worked a little too well. Now that supercharged immune system is confused, and it's attacking her colon. It's the perfect definition of friendly fire, and trust me, it is incredibly dangerous.
So the immune system is officially out of control and attacking its own body. What do you do? Now, this is one of those critical moments in medicine where the most obvious, intuitive answer is actually the most dangerous one.
Your first thought might be, hey, let's just stop the diarrhea, right? Give her something like Loperamide. But in this specific situation, that is an absolutely catastrophic mistake. It can lead to something called Toxic Megacolon, where the bowel just swells up, stops working, and can even rupture. No, that is not the way to go. Here's the key. You have to treat the cause, not the symptom. The right move is to immediately hit the brakes on that runaway immune system, and you do that with high-dose intravenous steroids. You have to shut down the friendly fire before it burns the whole place down. Now, let's flip that coin completely over. For our second case, the problem isn't an immune system doing way too much, it's an immune system that's basically gone offline. So meet patient number 2. She's younger, being treated for breast cancer. It's been exactly 1 week since her last round of chemo, and now she's got a high fever. She just feels awful, but there are no obvious clues about where an infection might be. And that scenario right there, that is a massive red flag in oncology. Let's look at her numbers. Temperature, 38.7 Celsius, definitely high. Heart rate's racing at 112, both signs that her body is trying to fight something. But then you get to the blood counts, and the whole story takes a terrifying turn. Her total white cell count is 0.4. That is shockingly low, but that's not even the most important number on this screen. 0.1. That's her neutrophil count. Okay, to put that in perspective, neutrophils are your immune system's frontline soldiers. They're the ones who fight off bacteria. A normal count is somewhere between 2 and 7.5. Hers is 0.1. She is, for all intents and purposes, completely defenseless.
This emergency has a name, Febrile Neutropenia. The chemotherapy, while killing off cancer cells, has also just decimated her bone marrow's ability to make these critical infection-fighting cells. That fever is the only signal she has that a deadly infection might be taking hold. The fortress guards have all been sent away, and the gates are wide open for attack.
So the fortress is unguarded, and you know an enemy is already inside. What is the single most important thing you have to do, and I mean right now? In this scenario, waiting is not an option. A wait-and-see approach, that's a direct path to overwhelming sepsis and death. Without any neutrophils to fight back, a small infection can become fatal in just a matter of hours. There is no time to waste. The only right answer is to act immediately and aggressively. You take blood cultures to try and figure out what the bug is, but you absolutely do not wait for the results. You immediately blast them with powerful, broad-spectrum IV antibiotics. You're basically sending in the special forces because all the regular guards are gone. It is a desperate race against the clock.
So we've just seen two emergencies that are complete polar opposites.
one where the immune system is doing too much and one where it's doing nothing at all. Let's put them side by side to really see the difference.
And this is the whole game, right here. On one side, you have an overactive immune system caused by immunotherapy, and you have to suppress it. On the other side, you have an offline immune system caused by chemotherapy, and you have to step in and fight infection for it with antibiotics. Giving the wrong treatment to the wrong patient would be an absolute disaster. Two sides of the same deadly coin.
And for febrile neutropenia in particular, the playbook is simple and it is non-negotiable. You see a fever and a neutrophil count below 0.5, you get blood cultures, and you get those IV antibiotics in within the first hour. Any delay can be fatal. It's really that simple.
You know, at the end of the day, that's really what this all boils down to. It's not just about knowing the different treatments. It's about knowing which emergency you're actually dealing with. Because choosing the wrong path, well, it doesn't lead to a good place. Recognizing which path you're on is the most critical step you can take.
And that really leaves us with this final thought. As our cancer treatments get more powerful, more precise, they also demand that we become more vigilant. That line between a life-saving therapy and a life-threatening complication is getting thinner and thinner every day. And mastering that tightrope walk, that's the real challenge of modern cancer care.